And now to the pandemic and the battle over a life-saving COVID treatment, monoclonal antibodies. That's what then President Trump was given when he had COVID. But there is now a bitter fight in Tennessee over who gets that treatment. And there's also some big news tonight for the nearly 15 million Americans who got the Johnson & Johnson shot. Here's CBS's Mark Strassmann.
Johnson & Johnson's big news: a second dose of its vaccine is 94% protective against symptomatic COVID in the U.S. Nearly 15 million Americans already have received the single-dose regimen. Tonight's other headline affects a treatment for people with COVID called monoclonal antibodies, synthetic antibodies that reduce death or hospitalization by at least 70% in high-risk patients.
It's essentially boosting your own antibodies and your immune system.
Problem is, not enough supply, especially in states like Tennessee with low vaccination rates. Barely half of eligible people here have been fully vaccinated, America's fifth lowest rate. Until last week, most of the limited supply went to southern states where vaccination rates are low. Last week, the Biden administration said it will reallocate supplies across all 50 states. And with more demand than supply, Tennessee's new policy prioritized the unvaccinated. So vaccinated people who get breakthrough infections might have to go to the back of the line. The State Department of Health said in a statement, ultimately, this comes down to providers' clinical judgment to ensure those most at risk are receiving this treatment.
Isn't there potential you'll have to ration care?
I think we'll have to use intelligent decision-making in terms of deciding who would benefit the most from the care.
Dr. Karen Block runs Vanderbilt's COVID infusion clinic in Nashville. It administers 80 monoclonal antibody treatments a day.
In the minds of unvaccinated people, this is their safety net.
If it is, that's probably the wrong way for them to be thinking about it.
These clinics typically have no way to verify someone's vaccination status. It's the honor system. So potentially a pitfall here, vaccinated people claiming they're unvaccinated in order to get the treatment. Norah?
Mark Strassmann, thank you.